me, Doctor of Physical Therapy here at Greencastle Physical Therapy. I'm here with my assistant Kelsey, and we are going to go over the bird dog exercise. I'm going to show a little bit of progressions to get into it in the event that you're having a hard time getting into the complete exercise. But to do this one, we are going to be in a position we call quadruped, so that is on our hands and knees. I'm going to get on your hands and knees here. Just this position we want to set up well. So we want our knees right underneath our hips. A lot of times I will see people way back here. Move your hands back a little bit. So they're in this position. In this position, we're actually working more of our thighs and not so much of our core. So we're going to shift the body forward so that now those hips and those knees are in a straight line together. We're now asking our core to do a little bit more of the work here, which is what it's designed for. We want those shoulders, those hands right underneath the shoulders. We're going to rotate those biceps forward a little bit and lift the mid back. So our spine now, head lifted, is just in a very good setup position. This helps us to, as we move forward into the different movements of our arms and legs, have a good setup so that we ask our core and our low back, all of those muscles, to work to the best of their ability and get stronger. From here, the first one we can start with, if that full expression is difficult, is keeping our pelvis and everything in line, and then we're going to lift one arm at a time. What we want to watch out for as we do this, we don't want to shift our weight, so I'm actually going to lift the other arm. We don't want to shift our weight to lift it, because then we're actually just doing a really good balancing act. We're not using our muscles to smooth that motion and to allow them to really work to keep that spine from twisting and rotating, which every day as we go and move through life, we want to see if we can have our spine nice and controlled to do anything that we need to do. So we can start here, alternating back and forth. Again, don't let those hips shift backwards. So sometimes as you go and lift one arm, we naturally sit back because our core and our back have to work very hard. If they're in that very, very precarious, stable position, they're asked to do a lot of work to keep our spine lifted over that empty space. So that is the first one. You can start with 2 sets of 10. Make sure you breathe while you do this. Also, don't lift that arm too high. If you start to lift your arm up and you have to drop that head forward or arch your back, that's too high. Go as far as you can and lower back down. The next step, now we're going to lift one leg at a time. Same thing, we're going to make sure our weight stays pretty even. Common compensation with this one is actually that hip will drop or it will lift up. So as you can see, we're getting a lot of twisting in that low back and the spine. We twist every day, but the goal of this exercise is to help our body know what does it feel like, lower back down, what does it feel like to be controlled in that position. So this is asking those muscles, okay, this is what control feels like, and to strengthen them very specifically in those positions. So again, we're not shifting our weight too much as we go side to side. We're really feeling these muscles here as we lift. They're asking all of the muscles in these areas to engage and give us that really strong foundation that we can move from. Same thing with 2 sets of 10 to get us working here. The next and final progression of this one, now we're going to alternate arm and leg. So you can start even just crawling them out with the fingertips and the toe down. So if you crawl those fingers out, have that toe down, that's our setup, just to say, okay, can I hold this position already without shifting my weight too much? Usually we want to shift into that hip just because it's the strongest, it's the biggest. So we're trying to keep that weight shifted over a little bit. She's already shifting on me. And all the things apply. So hips shifted forward a little bit, so we're right in a good alignment. We're keeping that shoulder blade on our back. Good lift through here, no rounding. And now we're going to lift opposite arm, opposite leg. And she has some tightness in her hip here, so she is not going to be able to get it all the way straight. Eventually we would like to get to that point, but go ahead and lift higher with that hip. So if we lift higher, you can see she actually has to twist and arch because she just does not have the flexibility in that hip. And that causes a lot of compression in the low back. So we're going to drop that hip down, allow things to be in a very open position. Our spine is neither rounding nor dropping down. Go ahead and lower back down. You can start with just a lift, controlled lift and lower, and then alternate to work on the smoothing of that transition through the core muscles. You can do holds as well. So lift opposite arm and opposite leg, breathing into the diaphragm and the waist, and hold it just to practice. Okay, now I'm engaging all of the muscles in my core very, very well as we go through this exercise. And what that is supposed to do is as we get stronger here on the mat, we can move into everyday life and have the ability of those muscles to be available when we do walk, when we do twist, when we pick up children or pick up laundry baskets. or just kind of doing work, having to lift up heavy equipment. These muscles then are ready and able to work because we've taken time to do this exercise.